5 minutes of questions.
Thank you, Madam Chair, and I want to thank each and every one of you for being here today. This is an extremely important subject, and especially want to thank you, Ms. Irving, for being here. Yours is quite a compelling story, and we just cannot say enough about your courage and your work, and we thank you very much for that. Ladies and gentlemen, I'm from the state of Georgia. This is obviously maternal mortality is a national problem. There's no question about that. But in the state of Georgia, it is a serious problem. In fact, we have the unenviable position of being the number one state in the nation in maternal mortality, and for what reason we can't figure out. But that's what really is driving us to try to do something about this. And I've been doing it. I've been doing it in my district. I've held many roundtable discussions with different groups about why is this and how can we address this situation and how can we make things better, because we all want to make it better. Regardless of which side of the aisle you're on, you want to make it better. This is not a Republican, this is not a Democratic issue. It does not discriminate against anyone. And we have to work toward a solution. And I have to tell you that I'm really proud the last session that Representative Jamie Herrera Butler, her bill, Preventing Maternal Deaths Act, passed, and that's good. It was signed into law. We need more bills like that, and I'm really proud of that. I will have to tell you that I'm a little bit disappointed that we don't have some Republican bills that we're talking about here. In fact, we don't even have much Republican input in these bills, and I hope that that's going to change for a couple of reasons. First of all, we've been out in our district for the past 5 weeks, and I have been proudly proclaiming that not only do I serve on the oldest and the most diverse and as far as subject matter is concerned, committee in Congress, but also the most bipartisan committee, and I consider it to be the most bipartisan committee. So I am a little disappointed. I have to express that to the chairperson that we don't have more Republican bills. Now, having said that, I will tell you that I do have a bill that I'm working on with Representative Catherine Clark of Massachusetts that has to do with Medicaid. It's a Medicaid demonstration project that tests how we might be able to enhance access to care by better utilizing birth centers. All throughout our testimony today, what we've heard about is access to health care. That is extremely important in the solution to this problem. We all understand that. And birth centers, I think, are not being utilized to the point that they could be. And I hope that it's something, and I thank Ms. Clark for working with me on this, and it's something that I want to work with her on. Ms. Ron-Jean, I will ask you first. Again, one of the things that we've heard during this testimony has been access to health care. And I would just ask you, is there a better place or a place for a better use of birth centers that we could possibly use them in a potential solution or partial solution to this national health problem?
Well, thank you for the question. Just as Medicaid policies vary between states, it's a similar situation with birth centers. And so while birth centers themselves are not my area of expertise, I know that the availability and the certification and the licensing procedures and practices vary between the states. And so I could certainly see that there would be room for growth and of presence in birth centers and coverage under Medicaid. But again, the availability and access, those vary a lot between localities, and the financing policies would then have to be worked out with it.
Right. Well, and one thing that I will inform you about is that I represent South Georgia. There are two Georgias. There's Atlanta and there's everywhere else, and I'm in everywhere else. So birthing centers are extremely important for us, and particularly in the rural areas. So that's why I look at that, and I'm excited about this bipartisan bill that Representative Clark and I are working on. Dr. Nelson, I want to ask you, currently I'm the only pharmacist serving in Congress, so I have a very interest in opioid epidemic, and a very strong interest in how it's impacting maternal health. And I just wanted to ask you, could you very quickly help us to understand, when you have a mother who is going through an opioid addiction, how they are handled and treated during the pregnancy?
So the problem with opioids is also a major crisis for this country. In 2017 alone at Parkland, we delivered 69 women with opioid disorder. In 2018, I personally toured Dr. Gerard and Dr. Adams, the Assistant Secretary for Health and the U.S. Surgeon General, through Parkland Hospital to see our program. And our program is comprehensive, and the challenges are both related to the maternal care, the risk to mom, but also the neonatal opioid withdrawal syndrome risk to the baby. And that is a chronic, life-changing opportunity for us to have resources provided for a pregnant mother and her unborn child.
Just real quickly, just how do you get over the stigma, or not stigma, but the obstacle of a mother who is addicted that doesn't want that to be known, so she doesn't reach out for care? I know that's got to be a problem and something we've got to address as well.
I agree that stigma is important. Our service as physicians is to be a healthcare home for those patients and to provide them access. And that's a complex issue related to interfacing the legality of some of those circumstances. But our first and foremost effort should be providing access to care to those women and getting them resources to potentially even get better.
Great. Again, thank you all for being here. So this is a most important subject, and especially for the state of Georgia and for our country. Thank you, and I yield back.